Diabetes, also known as diabetes mellitus, is a chronic disease that affects how the body processes the glucose, the primary source of energy. Diabetes occurs when the body cannot produce enough insulin or when it is unable to properly use the insulin it produces. Insulin is a hormone that is produced by the pancreas that regulates the blood sugar level. When we eat, the body breaks down the carbohydrate into glucose, which enters the bloodstream. Insulin that helps transport the glucose from the blood into the cell, where it is being utilized for the energy. In people with the diabetes, the body cannot effectively move the glucose from the bloodstream into the cell, leading to the high blood sugar level. There are three main types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes, also known as juvenile diabetes, usually develop in childhood or adolescence, although it can occur at any age. In type 1 diabetes, the immune system mistakenly attacks and destroys the cell in the pancreas that produces insulin. This results in the little to no insulin production in the body, requiring daily injections of insulin to manage the blood sugar level. Type 2 diabetes is the most common form of diabetes, usually developed in adulthood but can occur at any age. In type 2 diabetes, the body becomes resistant to insulin or does not produce enough insulin to effectively regulate blood sugar level. This can be managed through diet, exercise, medication, and some insulin injections. Gestational diabetes occurs during pregnancy and usually results after delivery. Hormonal changes during the pregnancy can cause the insulin resistance, leading to the high blood sugar level. Gestational diabetes can increase the risk of complications during the pregnancy and childhood, as well as increase the risk of type 2 diabetes. Symptoms of diabetes include increased thirst and frequent urination, increased hunger, fatigue, blurred vision, slow healing of cuts and bruises, numbness or tingling in the hands or feet, unintentional weight loss. Type 1 diabetes. Diagnosis of diabetes is usually made through the blood test that measure the blood sugar level. A fasting blood glucose test measures the blood sugar level after an overnight fast, while a random blood glucose test measures the blood sugar level at any time of the day. A hemoglobin A1C test measures the average blood sugar level over the past 2 to 3 months. Complications of diabetes can be serious and can include cardiovascular disease, kidney damage, nerve damage, eye damage and blindness, foot damage including the amputation, skin conditions including infection and ulcer, hearing impairment. Management of diabetes usually involve the healthy diet, regular exercise, monitoring the blood sugar level. Medication including the oral medication and the insulin injections may also be prescribed to manage the blood sugar level. Regular checkups with a healthcare provider are important to monitor blood sugar level and prevent complications. Prevention of type 2 diabetes include maintaining a healthy weight, engaging in regular physical activity, and following a healthy diet. Screening for diabetes is recommended for people with a risk factor such as a family history of diabetes, obesity, and a sedentary lifestyle.